हेलो। अंदर बागुन्नारा। कैसे हो आप लोग? लेट्स डिस्कस द नेक्स्ट 50 MCQs of our FMG guest paper. Okay, so let's go. I request everyone to please download the PDF which is in our group. The link in the description, guys. Okay, so that it will be easy for you guys. Okay, so you can also join my Telegram group. I have I'm also doing the daily MCQs discussion and also the topics and also the conducting the quizzes also simultaneously subject wise. Please have a look and join the Telegram. Okay, so this is the quick review of the 50 MCQs. Okay, so let's go. The first question is, what drug act there? Clearly see that in examination, guys, you will get this image, the nephron image. They will just mark anywhere. Okay, see, they marked here. See, this is the thick ascending limb of loop of Henle. What drug will act there? It's the loop of diet. This is the loop diuretics example, furosemide. If they ask here means at the DCT, early DCT, distal convoluted tubule, which is the what drug? Thiazides there. Okay, examples hydrochlorothiazides here. Lubiotics, furosemide. What about in the collecting duct? It's the spironolactone. Simple, it's very simple, guys. Please remember this one. You'll get the one MCQ. Next one, diagnose the given X-ray. See here, it's very easy from the pediatric guys and also in the radiology part. See, first one is the tab VR. I think everyone knows this is look like the snowman pattern, snowman appearance. Tab VR. See the Ashton anomaly. It's the heart, box-like heart shape. This is the lithium intake during the pregnancy. Okay, this is the TGA, egg, egg-shaped heart. See, TGA, G for Guddu in Telugu. Okay, Guddu for TGA, snowman. TOF, tetralogy of Fallot. What is tetralogy? Means four things. What is the pulmonary stenosis, right ventricle hypertrophy, overriding of aorta, and the VST? These are included in the TOF. Remember that one. VSD is most common in the pediatric and the AHD common in the adults. Okay, so you can also remember the what are cyanotic and acyanotic examples. Cyanotic, TOF, pulmonary stenosis, TGA, TAP, PR. So acyanotic examples here. Okay, my mom is cooking. Okay, so and also you have to remember the murmurs, guys. The most important murmur is the machinery type. So the is in the PDA. Okay, artificial. Then side effects of lithium. So first one is lithium. Remember the mnemonic as lithium itself. Lithium, lithium, L, leukocytosis, I, insipidus. What insipidus? Diabetic insipidus. T, tremors. H, hypothyroidism. I, increased weight, obesity. U, upsets, that is stomach upset, having GI problem. Malformation, that is the Epstein anomaly. It's very simple. Very simple. Next is side effects of amiodarone. Remember the mnemonics? I created this one. PCB, MLA, nothing. Nothing. PCB, Pakistan Cricket Board, MLA, nothing. ND. See here, pulmonary fibrosis, corneal verticillata, there is a microdeposition. B for blue colored, it's a blue man syndrome. Myocarditis, acute and QT prolongation, liver toxicity, neurotoxicity, alpha receptor blocker, which causes the hypotension and also causes the photosensitivity, thyroid problems. See here, we are having total of hypo and hyper both, but hypo is more common than hyper. It's very simple. Next one is after binge drinking of alcohol, a young male presented with vomiting and upper GI bleed. The most likely cause is Mallory Weiss syndrome. Just remember, guys, we have two scenarios here: Boerhaave syndrome and Mallory Weiss syndrome. The same, see, for this syndrome, for these two cases, the history is always same. This is binge eating. But one thing here difference is, guys, here we have in the Meckel's triad, guys. In the Boerhaave syndrome, we have in the Meckel's triad. That is the chest pain, vomiting and retching, subcutaneous emphysema, and also you can see the continuous diaphragm sign. If anything from the triad, they can mark the answer as the Boerhaave syndrome. Or else it's going to be the case of the Mallory, which this is just a tear. It's a perforation, guys. Okay, now there is a perforation. That is the treatment is a thoracotomy plus mediastinal lavage. Okay, now here is the self-limiting, guys. Okay, now remember the most common site is the gastroesophageal junction. Are you okay? Which is contraindicated in this case. In this case, you can easily see here. This is the boil loops in the chest. Here you can see here. It means what is the case of the congenital diaphragmatic hernia, defect in the pleuroperitoneal membrane. We have a triad called respiratory distress, dextrocardia, scaphoid abdomen. What you have to do is the first one you have to always do the X-ray. We'll see the boil loop established in the thorax part. Okay, na? So always remember, guys, bag and mask ventilation is always contraindicated here. Okay, na? You have to always go with the intubation. The most common cause of death is the pulmonary hypoplasia. And please remember this one, guys. Sometimes they will ask that if the herniated organs are in the left side, it is called as Bojgleg hernia. So most common is the Bojgleg hernia. Right side is called as the Morgagni hernia. Are you okay? अर्थमవుతుందా? समझ में आ रहा है? समझ में आवत बा कि नहीं? Next one is the interception and the Meckel's diverticulum, Hirschsprung disease. Please, guys, remember this one. Please study this one. Intersubsection, Meckel's diverticulum, and the Hirschsprung disease, guys. Okay, now please remember. I don't want to explain this one. You have to read these three diseases here itself. Okay, and then also, guys, here you can see that you can see here we have in the esophageal atresia. Out of them, the type C is the most common. Everyone knows. V for what is the vectorlysis, V for vertebral, A for anorectal, C for cardiac, T for thoracoesophagus, esophageal fistula, R for renal agencies, L for limb defects. Sometimes the questions also asking to what is the full form of A, V is like this one. So for the GERD, guys, I think everyone knows what is the gold standard in this question of choice. It is going to the 24 hours ambulatory pH monitoring. Okay, na? And also, guys, remember the Jenkins diverticulum. Okay, outpatching from the esophagus. Then the Killian distance with the most common site between the it is located between the thyro and the cricopharyngeus muscle. Simple. Achalasia cardia, failure of relaxation of the lower esophageal sphincter due to absence of ganglionic cells in the R bag and myotonic plexus. Also differences are the VI. It is characterized by diagnosed by Chicago criteria. Okay, na? We'll see the bird beak sign. Bird beak sign in the bird beak sign. If in the see here barium swallow. Say barium swallow. In the barium swallow, we'll see the bird beak sign. This is the case of the achalasia cardia. The barium enema. Barium enema, we'll see the bird beak sign in the case of the sigmoid volvulus. And also here the congenital hypertrophic pylorus stenosis. See, due to the intake of the erythromycin during the pregnancy, see, every time they will give the one line, see, projectile non-bilious vomiting and a hypertrophied pylorus. If it is due to the hypertrophy of the pylorus, that's why what happened, the HCl will throw out, which causes the metabolic alkalosis, hyperchloremia, hypernatremia, paradoxical aciduria, and the surgery is the Ramstead pyloromyopathy. Okay. So next one is, guys, please remember the gastric and the duodenal ulcer. Okay, and also I think everyone knows about the a single, double, triple, multiple air bubbles signs examples. I think everyone knows about this. Okay, and next one is the Crohn's and the ulcerative colitis. Please study this. Please study this very clearly. Okay, don't want to. I don't want to go. I'm not going to elaborate this one, guys. Okay, just you have to pause the video, or you can study from the PPT. Okay, next one is, guys, coming to next one. See here, myopia, hypermetropia, astigmatism. Myopia is a nearsightedness. See here, what happens here is that light will fall in front of the retina. Right, light will fall in front of the retina. They will also give the history of history of a child is squeezes his eye. A child is squeezes his eye, squeezes his eyes to see the objects. Squeezes his eyes to see the objects. To the case of the myopia. See, we can correct that or concave lens. Hypermetropia, convex lens is the correction. See here, light will falls behind the retina. Light will falls behind the retina. Okay, na? Here they will give the case of the asthenopia. The child will rub his eyes. Child will rub his eyes to see the objects. The hypermetropia, astigmatism. There is a more rays on the retina. Light rays do not focus at only one single point. There is multiple rays. Okay, na? Correction is toric or cylindrical lenses. So the next question is, so guys, the next question is that retinoblastoma and the congenital glaucoma, the hypothalamus. See, retinoblastoma is the most common presentation is the leukokaria. Leukocoria. Okay, the chromosome responsible is the 13q and 14. RB gene. This is the Knudsen two-hit hypothesis due to, okay, now it follows. Chemotherapy, we will see the vincristine, VEC, vincristine, etoposide, and carboplatin. Okay, now histopathology will see the flexor intestinal project. Coming to the congenital glaucoma, see the hypothalamus. They will use some cases and the image. There is a blepharospasm. Okay, photophobia. There is a lacrimation. Okay, now, for the surgery of choice for the congenital glaucoma with the clear corneate is a goniotomy. With the hazy corneate is the trabeculotomy. Okay, now next question. Please remember these images, guys. Okay, na? I have here. Okay, here. Um, Iridodialysis. This is the case of the iridodialysis. Collagen, sty, ophthalmia, neonatrium. Last time they gave this one. This is the list node seen in the seen in the NF1. This is the KF ring, Wilson's disease, foreign body. This is the water, limbal, desmoid, pterygium. This is the PDR, NPDR. Please see this one. Okay, na? Please see this one. The next one is Menkes versus Wilson's disease. Menkes, MD deficiency, Mendi. Okay. MD means Menkes disease, copper deficiency, chromosome 17. That is the Wilson disease, copper toxicity. See, Menkes, M will come first. So the 7A. Later, W, 7B, ATP 7B. Here it is due to the options are what enzyme? Lacyl oxidase enzyme deficiency. We have the kinky hair, fractures, and there's hypotonia. This is an X-linked recessive. Coming to the here, Wilson disease is the copper toxicity, chromosome 13, ATP 7B. This is the copper secretion into the bile. This is the autosomal recessive, and here we will see the Kaiser-Fleischer ring in the eye here due to deposition of the copper, and also we can see the sunflower cataract. Where what side of the lens it is the Descent membrane. It is the Descent membrane. Okay, done. The next one is the reflex hallucination, patients seeing red colors while listening to FM radio, flashbacks phenomenon, taking tip hallucination, what poison it is going to case of the LSD, lysergic acid diethylamide. So okay now, so please remember this one. And also, guys, apart from this, you have to remember the amphetamine, cocaine, datura, lead poisoning, cannabis, and stretchness poisoning, opium poisoning. Please, guys, study this one. Okay, now please pause the video, or else you can study in the PPT. This one, a gunshot case brought for autopsy shows a round entry wound with inverted margins and surrounded by tattooing. Burning and singeing of hairs is not noted. What is the range? See here, only tattooing. See, very simple. Okay, now no need to study all the shits. Just remember this one. See, tattooing, only tattooing is present. So near means only tattoo. So see the near shot. Contact means it is the stellate or elevator is the largest type. This is the you'll see the star shaped lesion entry wound. Okay, this is the star shape, stellate star shape. This is the contact. Near is one tattoo. Close means all. SBT means all singeing, burning, tattooing. In the close shot, we'll see the all the SBC. Please try to please try to study the question carefully, guys. Either all present or only tattooing present or only there is a stellate shape present or there is a contusion, abrasion, greases and a short exit. Like whether everything is present. The contusion also present. Okay, this is how you have to answer the question. Okay, now no need to remember that all that shit. Just remember this one. It's going to be very simple and it will help you to solve the MCQs. Next one is, which of the following autopsy technique is associated with the in situ dissection? In situ, it is the rocket autopsy. See the in situ, this is due to the infection of the due to it having the infection pillage to avoid the infection spreading. So that's why, like for example, HIV patient, COVID patient. So that's why you have to cut the body inside only without removing the organs. So and also we are having the lateral type, which was which autopsy, Guns autopsy. In the lateralis, you remove the en masse altogether, which was VV11 by one, most common one, and the guns block by block. And also you can see here we having the incisions here, inverted Y-shapes in the fetal death, X-shapes in the custodial death, modified Y-shapes in the asphyxia cases. Please remember, and also here are the most common is the loop type, and here is the hole type, fingerprint, and it's the archer type. Okay. And guys, also please remember the poisoning and the antidote. Poisoning and the antidotes of the some important drugs. Please remember this here the acute and acute and chronic iron poisoning. Acute iron poisoning, it is in the des ferroxamine, and it is a chronic for that is a defi prone. Please remember the all the important antidotes. One MCQ is pakka. Please do not skip this. Okay. Here from the okay from the anatomy, guys, please remember the, I think everyone knows is the anatomical snub box. Anatomical snub box here. Okay, and snub box lateral side is the APL, is the abductor pollicis longus and the extensor pollicis brevis. Please show your anatomical snub box and try to correlate with this. So lateral में क्या है? Abductor pollicis longus, extensor pollicis brevis. Medial extensor pollicis longus, roof is the cephalic vein, there's a superior superficial branch of radial nerve. Content is only one, this is the radial nerve. Okay, now I think you also know this is the extensor flexor longus. This one always go in one with here, this one, like do like this one. This is the okay. This is the you are palpating what? You are palpating posterior tibial artery. Okay. This is the normal abdominal CT. Sometimes they will ask this one to locate what is this one. This is kidney, spleen, pancreas, splenic vein, gallbladder, liver. Okay, now And also, please remember that sometimes they also ask about the to to what to identify the bones and the X-ray. Okay, na? Remember the foot bones, tarsal bone, the carpal bones. Okay, please remember. And also, I think everyone knows about this one. This is supplied by what? They are what? This is supplied by deep peroneal nerve. Okay, only the this one. Only the first metacarpal toe, first toe. Only the first toe is supplied by what? Deep peroneal nerve. Okay. And also, guys, please see here. A man came to the OPD with complaints of difficulty in flexing at the elbow. On examination, the clinician found there is a sensory loss toward the lateral aspect of the lateral aspect of the forearm. Lateral aspect of the forearm. Lateral aspect of the forearm. It is a good sensory part of the musculocutaneous nerve. Okay, now most of you guys are always confused about this. They are marking the radial nerve. Okay, now please remember this one. Okay, and also, guys, I think everyone knows about this one. Everyone knows about this one. Okay, only this part, only this part is supplied by what? Supplied by what is that? Median nerve. Okay, now these are, so you can see clearly here. This is my hand, guys. Okay, now this one supplied by radial nerve. Only median nerve. This is ulnar nerve. And also you can see here there is a finger drop. This is a PI in posterior interosseous nerve, carpal tunnel, and cubital tunnel syndrome. The ulnar nerve, median nerve, carpal tunnel syndrome. Please remember this one. Okay. See, pathogens are destroyed by which type of cells? You can see here. Okay. So, guys, in CNS, guys, we have the macrophages. In CNS, it is called as what as microglia. In bones, osteoclast, spleen, sinusoidal cells, histiocyte, connective tissue, obioid cells, placenta. Please remember this one. And also, guys, a patient after trauma came to the ER. On neurological examination, he was found to have normal motor function but could not speak. Bolna మాట్లాడటం రావట్లేదు. Where could be the reason for his clinical condition? See here. See, बोलना, broadcast, बात करना. See, it is the non-fluent speech. This location is the inferior frontal gyrus. Motor speech. Okay, na. This is the area sensory. This is the area number. It is the 44, and Broadband area number is 45 and 44. And see here what happens here. The patient can understand everything but cannot speak well. Cannot speak well. He can understand, but this one. Wernicke's area. This is the word defect. The word is the fluent speech. He can talk. He can talk fluently, but he cannot use the right words. The area number is the 22, 39, 40. Wernicke's connected to Broca's by arcuate fasciculata. Injury to this leads to conduction aphasia. Angular gyrus injury to this leads to enophic aphasia. Can't name the word. Artery plus speech is connected by uncinate fasciculata. Please remember this one. And also, I think everyone knows about this one. A wave in JP is absent. This is the case of the what? Case of the atrial fibrillation. Please remember this also, guys. Please study this word JVP. And here we are having the teacher present. See, teacher presented. Okay. See, this is the case of the ocal nodule. See, guys, ocal nodule. See, ocal nodule. Do ocal nodule. This is two nodules here. Here only one. This is a polyp. This is the nodule. Okay, na. See, singers are teachers. This is called as vocal knowledge for the singers who are using more voices. Okay, in a long time, for the teachers guys, for per day they are using, they're talking up to like a 10 to 12 hours. So this is due to the overuse of the voices. Singers also the nodal polyp polyps for the singer's knowledge is the just a voice rest is needed. For the vocal polyp, this is the going to the benign or non-cancerous growth on the vocal cord that can appear as a blister or bump or stuck like a growth. This is most commonly unilateral only. Causes are like a trauma irritant such as smoking and GERD. Okay, now treatment is the MLS, is a microlaryngeal surgery. See here, maximum water reabsorption occurs from which part of the nephrons? I think everyone knows about it. The part A is the maximum water absorption, about 65% of the water, sodium, chlorine, 100% glucose, 100% amino acid, 85 to 90% of the bicarbonate, except the magnesium, which is absorbed from the ascending loop of Henle. Maximum secretion in the PCT, all except the potassium, which is in the DCT, VDCT, and the CD. Urea in the loop of Henle. Please remember this one, guys. Insulin stimulates glucose uptake by cells via glutathione. This is the example of the facilitated diffusion. See, this is the primary active pump. Primary active pumps. Examples are ATPs. Pumps are primary pumps. These are example of the primary active pumps are ATPs. Secondary active pumps are the sodium support, sodium iodide, glucose like a GLT. Okay, now passive diffusion we have simple and facilitated. Simple we are having the O2 and CO2 diffusion facility in the glucose transport. Please remember this one. Muscle physiology, you will get the two MCQs. Please remember when skeletal muscle contracts and giving stimulus, all the following happens during contraction except the J lines comes closer. J lines will not come closer. Please also guys, the actin myosin thin. It is the actin myosin is the thick. Okay, na? I think everyone knows about the mechanism. Okay, na? Please study about the muscle physiology, guys. You will get the two MCQs about this. Okay, two MCQs. Okay, a female complains of cramps in the breast while breastfeeding. Which hormone is responsible? See, cramps in the breast while feeding, it is the hormone is the oxytocin. See, oxytocin for milk ejection oxytocin, cramp also oxytocin, and galactokinase also oxytocin. Milk synthesis prolactin. Cortisol increase during the period of stress. Okay, insulin for the intrauterine growth. Please also study about the some important hormones. Most potent disinfectant is the sodium hypochlorite. You will see this one in the briefly in the upcoming slides. Also, guys, you have to remember the some of the genetic inheritance, like which is the autosomal dominant, autosomal recessive, and the X-linked dominant and X-linked recessive. Please remember this one. I don't know how you are going to remember, but remember these guys. Always they will ask from the dominant itself, or dominant from them. Please remember that. A child pigeon with the midline neck swelling, which moves with degradation. The diagnosis is the thyroglossal cyst. So this is the thyroglossal cyst here. So guys, this is the moves with degradation is the case of the thyroglossal cyst. You have to do the treatment is the cystic surgery, removal of the thyroid cyst. See, thyroglossal fistula. You can see here. Important one is this is the I think everyone knows the Ludwig angina infection of the floor of the mouth with the source of the history of the dental caries. Okay, now this is the cystic hygroma, branchial cyst. It is the branchial cyst is the anterolateral neck swelling. Okay, now this is the posterior. This is the posterolateral neck swelling. This is the cystic fibroma. Please remember. And also, guys, see here, it is from the vascular surgery, guys. A patient came to your clinic. Uh, Patient told that while he was walking, there is a cramp pain. Improve further walking. According to the see, this is the see, this is the gradual arterial obstruction, guys. We have the Boyar's classification. So please remember the Boyar's classification, guys. This is the grade one. The patient walks for the distance, get pain, and continues to walk, and the pain disappear. Patient walks for a distance, gets the pain, and then continues to walk with the pain. This is the grade two. See, remember these grades, types of grades, and we also please remember the ankle brachial pressure index, guys. The values we have to remember. Normal is the 1.1 to 1.1 to 0.2. If it was 0.5, it is the rest on. It means rest pain. 0.1 is gangrene. 0.9 is less than 0.9 is the intermediate claudication. Please remember these values are important. It's the Raynaud Finance also called a Raynaud disease. It is due to the spasm of the arterioles and the venules due to cold exposure or vibration. Second choice is the CCB, calcium channel blockers. Please remember the DVT and the varicose veins. DVT and the varicose veins are very important, guys. Please study about this one. Varicose vein, which is the most common set, is the saphenofemoral junction, guys. First is the valvular incompetence, cause is the valvular incompetence, and at the saphenofemoral junction. Please study about the DVT and the varicose vein. Pause the video, study, or else you can study in the PPT. Okay. Sorry for that. No time for that, or else the video is going to be long. See, a 30-year-old lady patient with a mobile lump, which is described the breast mass. See, breast mass, the most common diagnosis is the fibroadenoma. Fibroadenoma. The most common cause is the breast lump. It is the fibroadenoma. It is seen in the adults and adult girls from the age of 15 to 25 years old. You can see it is the popcorn calcification. Popcorn calcification. Okay, now treatment is the observation and the follow-up. And this is the breast engorgement, guys, due to refusal of the feeding. Due to the retention of the, so if the lady is not given the milk to the baby, it is called the retention of the milk, and we call the breast engorgement of the breast. It feels the heaviness of the breast while the mother if the mother is not giving the milk to the baby, it will cause the heaviness. Okay, also please remember the mastitis, breast abscess here, Tyler disease, and also this is the phylloid tumor. Please remember this one. The next one is you can also please remember this, guys, the TNM staging of the breast tumor. Please remember the T4, see here, T4B, see this is the T4B and T4D is very, very important, guys. T4D and T4T. T4D is skin involvement. This is a satellite lesion. There is a PD orange. PD orange less than 1/3 inflammation part. Third, okay, na? Please see, this is only the skin involvement is the T4B. T4D is the inflammatory breast cancer. Okay, na? This is the worst prognosis. See, T4D is the inflammatory. It is the inflammatory breast cancer. This is the only skin involvement. But here it is the T4D is the inflammatory. Okay, na? Please remember this one, guys. They are always giving the T4B and the T4T. Last, please remember the molecular classification of the carcinoma of the breast. See here, see here, luminal A, luminal B, HER2, basal. Luminal A and luminal B, guys, see here, there is a ERPR positive for both luminal A and luminal B. But what is the difference? Luminal A is the HER2 negative, the luminal B is the HER2 positive. So HER2 negative, best prognosis, HER2 positive is the bad prognosis. There is a BRCA2 positive in the A and B. HER2 negative, HER2 is the only the HER2 is positive and the ERPR is negative. Bad prognosis. Basal, it means all three are negative. This is but there is a BRCA1 positive. It's the worst prognosis. Please remember this, guys. Okay. And also, guys, please remember from the breast cancer, guys, there is a invasive and a non-invasive. Non-invasive, guys, we have a ductal carcinoma in situ, lobular. Just remember see here, this is the invasive. invasive lobular carcinoma, guys, there is a Indian file pattern due to the loss of the E. catharine. E. catharine is the, and this is the going to the appear like pattern like Indian file pattern seen in the lobular invasive lobular carcinoma. Please remember this one, and also please remember this one. Ductal carcinoma and ductal invasive carcinoma is the most common types, and this is the best prognosis is the tubular and the push and also the worst prognosis is the inflammatory. Just remember these guys. Okay, just also, guys, for the treatment for the premenstruation for the premenstrual women, it is the tamoxifen, and the post menstruation we have to give the letrozole, anastrozole, and also to give the exemestane. Please remember this one. Okay. So here I go coming to the here. Please remember this is the tympanometry, guys. This is a tympanometry type A normal ear, type A S autosclerosis, autosclerosis, A D deception or ascites, B flat, B serious, B flat serious, serious otitis media, and C is negative the YouTube, ET extension tube block. Please remember these are the labyrinthine. This is the function. Okay, now cochlea, vestibule, semicircular canal. What is the function? Also, please remember this one, guys. And also, guys, this is the BERA and OA. The most common for the hearing screening for the hearing loss. It is the for newborn is the most common is the OAE, and is the best for major is the for NICU baby it is the BERA. Okay. And also, please remember this one. Also, this is the X-ray views of the on the. See, it is the X-ray views. Yeah, she is the Caldwell Waters views. Waters view, Paris view. Paris view also mouth open. Paris view, lateral view. Remember this one. This is the CSF rhinorrhea. Rhinorrhea. There is a halogen. Is a target sign. Halogen. The comfort test will confirmatory test will be seen as beta 2 transferrin confirmatory test, and there is a and the pressure is the stress. The most common cause is the cribriform plate fracture. And also, this see here, this is the Renal test is the Weber test, guys. Remember this one, and this is the Leafort and the Leafort 2, and this is the Leafort 3 fractures. Palate, maxilla here is the to the skull up, base of the skull here. Okay, please remember. Also, guys, there are some extra mileage from the ENT. I think everyone knows. So, pulsar tenus, rising sign, glomus tumor, mania disease here, sonoma, BPPV, vertigo for few seconds. This is acute mastocytitis, running of a mastocytic, pearly white, cholesteatoma, ET block of hearing loss. Type B is the SOM, serious otitis media. Male child, deconfliction, JNA, juvenile nasopharyngeal angiofibroma, putatinous, rhinophimoma, Ludwig angina. Please, guys, please study this one. We have some extra mileage for like they will ask us the case based. So I just pick some important one. Okay. The next one is the guys. Here we have the Jenka's diverticulum. I already discussed this one. Jenka diverticulum is the fossa frozen molder. This is the fossa frozen molder. This is the NPC nasopharyngeal carcinoma. This is the ET. This is the estrogen tube. Okay, now. Also, please, this is larynge of Malaysia. I think everyone knows about this one. We are in the inspiratory, striders, inspiratory, and biphasic expiratory examples. The pediatric in the larynx, it is the concept C3 level high, and this is the subglottic, this is the narrowest part. The adults, you can see. Also, guys, please see here once again. Anorexia nervosa and the bulimia nervosa. Please see here. Anorexia nervosa, the always see that the patient will be the underweight. Patient is always having the underweight, but the bulimia in the bulimia nervosa, the weight is always the normal or overweight. Here, patient always feel that, oh my goodness, I'm very fat. See, this is the she is, even though she's having the BMI is very less, but she feel that, oh my god, I'm very fat. So that's why she will restrict the energy intake. And guys, this one she develop the actually this is the anorexia nervosa is most common in the females. There is always the amenorrhea, the symptoms of starvation, and there is a decreased sexual development, guys. Disturb. Okay, now always you have to always differentiate between the anorexia nervosa and the bulimia nervosa, guys. Okay, now here the weight will be normal or overweight is the underweight. Okay. Okay, now this is the important one. This is the bulimia nervosa, guys. The binge eating, eating a lot of food in a short duration. The purging gas. They'll yeah, whatever food they ate, everything will be the come out. The purging the reflex because because they think that oh my god, after the eating food they think that I will become very fatty. That's why that's why they are going to use anything to come to bring the food out. The purging action for there is a, that's why when they vomit, guys, there is a all the acid will come out. There is a eroded of there is a cause of the callus formation. The teeth is the eroded enamel. There is a there is a bad smell and the um, salivary glands inflammation. Hypochloremia, metabolic alkalosis, the BMI is less than, it is the always less than. BMI is, sorry, mistake here, BMI is more than 18.5, okay now? Sorry, here BMI is 18.5, okay now? This 1 year old, see, this is, so see here, this is going to the case of the schizophrenia, delusion of grandiose, delusion of, see, you can see here, see, see, schizophrenia, guys, always there is going to be the one question. Delusion means what? Delusion means a false belief. Persecution means patient thinks that they are against to them. Hallucination means there are two types: auditory and visual. Out of them, auditory is most common. The patient will have in the see the anhedonia. They feel that the patient is not get the patient will not get the interest in doing anything. Okay now catatonia, the patient will not move to any places. They will sit like they're in the one place only. And the hallucination, I think everyone knows about the hallucination. Like they will heard like different types of sounds. Okay, na? The echolalia means echolalia means so whatever the doctor is telling. What's your name? The patient telling what's your name? Echopraxia means doctor is doing like this. The patient will also do like this one. Catatonia, and the treatment is the antipsychotics. See here, the MSc has a mini mental status examination. See, you have to ask the questions in the MSc for the orientation, guys. For the orientation checkup, you have to always ask the sir, what is the time now? Where are you now? Okay, now like this one. For the attention test, guys, you have to do the digit repetition, like this one, guys. Like just sir, please tell that. Can you please tell me the like can you just tell me that like 1 to 6? Okay, 1, 2, 3, 4, 5, 6. Can you please tell the backwards also like from the like 6 to 5, 6, 5, 4, 3, 2, 1 like this one. For the concentration, guys, you have to do the serial 7 is subtraction test. Sir, can you please subtract from 100 to 100 from 7 like this one? 93 from 7 like this one. They will tell the answer. This is the minimum test you have to ask in the MSc examination. Also, please remember the extrapyramidal side effects. I think akathisia, Parkinsonism, tardive, tardive dyskinesia, treatment. This one, guys, prosopagnosia. This is the unable to identify the face. There are some phobias, the Frigoli syndrome, Capgras syndrome. Delusion is a thought, false belief, hallucination, persistence without stimulus, hallucination with the misinterpretation with stimulus. Depression, guys, you have to know about the this is a low mood is the most common. Backstrad, hopelessness, worthlessness, helplessness. Sorry, it is a hopelessness, worthlessness, helplessness, decreased sleep, appetite, and loss of interest. To diagnose depression is that to minimize the criteria 2 weeks. Treatment will be the antidepressant. Bipolar 1, 2. Please see this one. This is the trichobejar, guys. Trichobejar, I think everyone knows. Due to the trichotillomania, picking of hair and eating. This is a psychiatric problem. You have to refer to the psychiatric. Also, please remember this is the OCD. OCD, guys. This is a Okay, see the OCD guys, obsessive compulsive disorder. So okay now the patient will having the compulsion of compulsion of checking, blasphemous thoughts like sexual thoughts of the gods. Okay, now like this one. So guys, this is the clinical course of the okay, the OCD. Sometimes they will also give give the photo like this one. Give the photo like washing the hand. You have to think about the OCD. This is the segment fluids or OA phalange, oral, anal, phallic, gender stage. Please remember this one. That is the clusters. And remember, at least remember the sub definitions and the what cluster A, cluster B, cluster C. And these are the alcohol withdrawal. Okay, now for 6 to 8, it is called tremors. 60 and 24 to 48 hours after it is seizures, 48 to 72 hours. These are the delirium tremors. Smoking cessation is between the vanillin, alcohol, disulfiram, and IQ 55 is mild. This is the body dysmorphic. You can see this is the disorder. Okay, they're from the psychiatry. From the also guys from the PSM, please remember the family cycle. Okay, na. I think everyone knows about this one. Family cycle means a normal family cycle is convinced as having 6 phases. You see, this is the formation, extension, complete extension, contraction, complete contraction, dissolution. Please remember this one. Okay, na? Just remember the cycle order, and also you can remember the what is formation, what is extension, what is complete extension. And also here, guys, please remember the what are these disease, toxin, and the adulterant. In what Casaridal is a boa, agrumine, mexicana is the sanguinary. Please remember this one disease and the toxin and the adulterant. Please remember this one screen time. Disease onset is the outcome, guys. Then the first positive point, second it's lead time. They will also give this image and mark the here. See what it is. This is lead time is the first positive point to usual first diagnosis is the lead point. Okay. A patient with hip dislocation on exam. See guys, this is the posterior hip dislocation. I will discuss about this further. This is the guys here. This is Champes glass pelvis. This is the seen in the achondroplasia. This is autosomal dominant. Champes is the delayed motor milestone. Pregnant at the birth, bowing of legs, proximal limb shortening. Seen in the achondroplasia, the autosomal dominant. This is the case of the see here. This is the bamboo spine. Ankylosing spondylitis is a rickets case. You can clearly see that here we have in the posterior dislocation of the hip. It calls the fadir. Fadir means what? Fadir means flexion, adduction, internal rotation. This is the fadir attitude of the limb. Faber, it is the flexion, abduction, external rotation. This is the anterior dislocation of the hip. Please also remember there are some radiology images, guys. Pulmonary edema, bat wing swine, and please remember that it's the hydropneumothorax, pericardial effusion. Please, guys, try to download the PDF in the group and try to study the images. And I'm not going to elaborate more, guys. Okay, I'm going to skip this one. Okay, please study this one. Please study this all. Okay, there are some important images. They are the important splints, guys. Important splints. Fractures, Gallagher and Montague fracture, Scuffer fracture, Boxer's fracture. See, these are the please download the PDF and the study in the PDF, guys. Okay, now. So true about the non-competitive inhibitors. I'll just see the competitive inhibitors is the Vmax, K increases. Everyone knows about this, the MCQ. Okay. Please remember the GLUT2 is the insulin independent, GLUT4 is the insulin dependent, GLUT5 are the fructose. Okay. See, fructose carries the fructose also using the GLUT5 transporter. Again, please remember this one. We have in the types of collagen, type 1 skin 1, type 2 cartilage T, 2 type 3 arteries and arteries is this is arteries type for floor of the basement membrane. See LDH type 1 to 3 you can see here, and also you can see the rate limiting enzymes and the cycles. Please study this one, guys. Please see here. I told that blood spiral the most important dysfunction is the sodium hypochlorite, guys. Okay, now please remember this table, guys. For the ethyl alcohol, this is the spirit swab. Acetyl alcohol is in the for the stethoscope and the thermometer. Glutaraldehyde for the everything, all scope like telescope, stethoscope, except the laryngoscope and the bronchoscope. We are use the glutaraldehyde. For the plasma sterilization, we'll use the okay now. Uh, wait, I need to break. Okay, run. Okay, see, please remember this table, guys. Six more. Okay, most characteristic finding of the diabetic nephropathy is the Kimmelston Wilson disease. Okay, see here, see guys, in the see uh from the nephrology, guys. Please remember the nephrotic and the nephrotic syndrome. Nephrotic means what? More protein. Nephrotic means hematuria. See here, child with edema. See here, actually see here. Nephrotic, guys. The most common disease is the minimal change. This is a minimal change disease, guys. This minimal change is the most common in the boys and girls. This is a see here. What is the minimal? Minimal means see minimal means, guys. There is a normal finding. If you see anything, is that minimal is only simple, only one change. Okay, see here. This is the normal see light microscopy. See, you can see here light microscopy will show the normal finding, but the electron microscopy will see the effacement of the food process. Okay, okay now, and also you can see here the acute nephritic. There is a hematuria. There is a periorbital edema, PHN. I think everyone has a history of the sore throat. Okay, I think everyone knows this one. And also, guys, please remember this one. If the history says history of cancer and the malignancy is the case of the membranous glomerulopathy, and the history of HIV is the FSGS. Focal segmental glomerular sclerosis. Please remember this one. It's also a polycystic kidney disease, and this is the polycystic kidney disease. Uh, this is the autosomal type is seen in the adults. This is the recessive type, guys, is seen in the pediatrics. Conjugated hypovolemia is seen in see. All see the doctors are conjugated. Doctor Dr. Dubin Johnson, Rotar syndrome, conjugated seen. Okay, others are seen in unconjugated, seen in the regular Najar type 1, type 2, type 3. Please read it. The defect is in OATP1. This is the MRP2 defect. This is the Dubin Johnson syndrome. Please also study this one. This is the dystrophic calcification. This is dystrophic and this is the metastatic calcification. These are the examples. This is the examples. This is the how to difference between the necrosis and the necrosis and the apoptosis. You have to see the differences, guys. What rises first in MI? See here also, guys. Last time also I also discussed from the batchmates. I'm also in the last I am also preparing for the Fmge examination. But I discussed this one, guys. This is ischemic modified albumin. This is the very earliest. This is the rises in the MI. This is the myocardial infarction, guys. This is the MI. This is the ischemic modified albumin. Is the apart from this is the earliest rise is the ischemic modified albumin. After that, is the HFBP. Then is the myoglobin. Then is the troponin. Most specifically, the troponin. Reinfection is the CKMB. To the CKMB, BB, MB, MM. This is the ECG changes. First is the tall T wave within the 30 minutes. This is the ST elevation. Okay, this is the Thompson appearance of the ECG. Also, guys, please remember the ORS. Why is because the salt absorption. Please remember the ORS composition. This is the from the respiratory physiology. This is every time you are getting the one MCQ from that one. This is the IRV, FRC, VC, vital capacity. Okay, now please see this. Please try to memorize this picture. Last one is the first heart sound. S1 coincidence with this. See, See, first is the also isovolumetric contraction, the S1. S2 is the isovolumetric relaxation. Please see this one. And also, guys, see this is the cardiac cycle. First, atrial systole begins. See, this is the first phase, second phase. This is the diastole phase. Remember the order. This is remember the PVR, QRS complex TVR, what this indicates. And also, guys, there is a reflection called baroreceptors. See the baroreceptor, I think everyone knows, which they control the BP. They are the stress receptors in the arteries. They are recorded in the aortic sinus and the carotid sinus. Okay. There also are serious reflexes. There is a Bain-Briggs reflex, Benjol-Cherik's reflex, and the Meyer's-Law reflex. Please study this one, guys. Also, guys, there are some latest update in the medicine. Nikshay Poshan Yojana incentive increased from the 500 to 1000 rupees. India free from trachoma. Nephritomycin, India launched antibiotic for drug resistant pneumonia. Kit 8 is introduced. Guys, this is the brown color for the unducted discharge. See, for the unducted discharge, the kit 1 and kit 2 is helpful, guys. Kit 1 and kit 8 is helpful. IPC change, I think everyone knows, Bharatiya Nyaya Sanhita, and also the National Health Mission renamed to Prime Minister Samagra Swasthya Mission. Existing Ayushman Bharat renamed to Ayushman Arogya Bandhe. Elagolic sodium oral generous for endometriosis, fibroid, and heavy menstrual bleeding treatment. There is a new regimen for the treatment of the MDR-TB. For 6 months, it is the bedaquiline, pretomanid, linaclotide, maxifloxacin. The doctor Mukt program, guys, 6 strategy. This is given in the 2 installment. The first installment is 3,000 rupees, second installment is 2,000 rupees. The indication and precaution for the MDR-TB. Okay, na? Using. Please remember this. I am going to share some PSM images, guys. Please read. Okay, na? Sandfly, redweed, bug, rat flea. What are the disease they causes? Please remember, guys. Okay, these are some important images for PSM. You can just download the PPT from the group and watch this. Okay. Points are, I think everyone knows about this one. Biohazards, Horax apparatus for the chlorine, chloroscope. This is the sling psychometer, cartadharometer, wind vane. Some female Anopheles mosquito, see here, Aedes mosquito, dengue fever, Culex mosquito, Nikshay. Nikshay is for TB, Nikshay is for what? Pregnancy kit. Nikshut is the leprosy. Janani Shishu Suraksha Karyakram. We have the newborn care, burn stabilization unit, special newborn home base newborn care. Remember this one, guys. Vaccine well modern. I think everyone knows. Mission in the Dhanashu. What are the vaccines came here? And guys, thank you very much for your participation, guys. And hope you all guys enjoyed the session. And guys, please, I'm not giving the surety that I'm not going to give the surety that you will get the 150 out of 150 MCQs, but I'm going to give the surety that you will get the 50 MCQs from these topics, guys. Which I please do not rely only on the MCQs, guys. Please try to study. Please try to study the topics which I shared with you, and okay, now. So all of you are going to pass the exam. Okay, now don't worry about this. All of you are going to pass the exam, and always believe on your hard work, guys. Okay, now you have to pass. You have to pass. You have to pass. Work, study for your parents. Study for your parents, guys. Okay, now you have to prove them. Yes, I am studying. Yes, I am studying. I can do anything. Okay, so thank you very much, guys. Love you all.